By watching this video, you'll learn everything you need to know about alcohol-induced neuropathy. Why should you listen to me? Who am I? I'm Dr. Brian Prax. I hold a diplomate from the American College of Physical Medicine. I'm also certified by the American Functional Neurology Institute as a specialist in functional neurology. I received a degree in chiropractic medicine in 1996, and I'm going to stop right there. No, we don't adjust away alcohol-induced neuropathy, but a chiropractor is one who thinks out of the box, an alternative specialist. I wrote a book called Reversing Neuropathy, Making the Impossible Possible. That was released in 2018. If you're interested, check it out on Amazon. The reason I subtitled it Making the Impossible Possible is most of my patients, and perhaps you, have been told you have neuropathy. There's nothing you can do. Learn to get used to it. Here's some gabapentin. Good luck. But there's a lot that can be done, and we do help make the impossible possible. I have this YouTube channel. We're approaching our 500th video and our 10,000th subscriber. And I would invite you to subscribe so that when new content comes out, you'll be notified right away. I started making this content back in September of 2010. I am the clinical director of our physical clinic here in Charlottesville, Virginia, and we've been doing that since 2010. We only treat peripheral neuropathy. The reason I say that is I know there's so many scam artists out there and are trying to do things. I'm an actual doctor in an actual building helping actual people just like you. I have an amazing team that surrounds me. Here we are in a recent picture. We have 7 of us here in the clinic, and we actually have 4 members who are virtual that are behind me editing these videos and putting this content out there for you. Also, we get results. Even though doctors say it's impossible, there's nothing that can be done, we have helped over 1,500 cases with an 85 to a 90% success rate with people suffering from all types of neuropathy. 82, probably more, but 82 of these case studies are on this YouTube channel. I would encourage you to watch those, study those, just so that you can know someone, or in this case, lots of people have been improved by peripheral neuropathy. Because if you think you can or think you cannot reverse it, you're probably right. That's a Henry Ford statement. But I would encourage you, get on there and start watching these people, hear their stories. It's the chicken soup for the neuropathy soul. Enough about me and my team. Let's get into the meat and potatoes about alcohol-induced neuropathy. Neuropathy, what is it? Neuro, nerve. Pathy, damage. Peripheral neuropathy. We need to define that. So let's first talk about how anatomists define the nervous system. It's so complex. We as humans, we have to kind of break it down in order to make it simpler. So what we do is we call the central nervous system, think about it, anything that's in the center of your body. So that's going to be the brain and the spinal cord. That's your central nervous system. It's your onboard computer, it runs everything, okay? Anything outside of that, peripheral to that, lateral to that, any nerve that leaves the brain and goes somewhere, that's part of the peripheral nervous system. The nerves that leave the spinal cord up here in the neck and go down the arms into the hands and fingers, peripheral nervous system. The ones that leave the lower back and go all the way down the legs into the feet and the toes, peripheral nervous system. Also, there's the autonomic nervous system. Those are nerves that leave either the brain or the spinal cord, and they swing inward and they go to your internal organs like the heart, the lungs, the liver, the sexual reproductive organs. Those we call the autonomic nervous system. And since these nerves leave the spinal cord or the brain, that too is part of your peripheral nervous system. So let's put it all together. Peripheral neuropathy is something that is affecting, damaging the nerves of the peripheral nervous system. So those nerves in the yellow. Okay. Now some of you are putting things together like, whoa, I wonder if my erectile dysfunction could be a part of the peripheral neuropathy. Yes, it could. What about my high blood pressure, my liver problems, my other problems that are related to my internal organs? Yes, it could be. Those are those nerves. Most common symptoms of peripheral neuropathy would be pain, burning, tingling, and things like that. We'll go into more of the symptoms a little bit later. It currently is affecting 20 million Americans every single year with neuropathy, and that number is climbing and climbing and climbing as more of us are getting sicker and sicker and sicker. Now, neuropathy can be caused by various factors. There's actually over 100 known causes, the number one being diabetes, but then we also have viruses like the COVID virus, we have bacteria, auto accidents and other types of accidents, slit disc, and alcohol abuse, hereditary, 100 known causes. This one is all about alcohol. So let's carry on to the next one. This presentation, today we're going to be exploring the connection between alcohol and the nervous system. We're going to talk about responsible alcohol consumption. We're going to talk about the effects of alcohol on the nervous system. We're going to specifically talk about the direct neurotoxicity, how the toxic components of alcohol affect the nervous system. And this is important, we'll define this on chronic, heavy alcohol use. We're not talking about a drink here or there, not usually. The role of vitamin deficiencies, because alcohol can cause vitamin deficiencies, can cause damage to those nerves. We'll cover common symptoms, risk factors, prevention strategies, and if you're already there, recovery options. Moving on. These are definitions and guidelines. There's several different areas. We do talk about light alcohol consumption, moderate, and we talk about heavy alcohol consumption. But moderate is generally accepted as probably not going to do irreversible damage to your body. But then again, there are no safe amount of alcohol to be had, right? Some people could have a problem even with one. So there is no safe amount, but we're talking some general guidelines. So the way it's most often defined with moderate alcohol consumption would be no more than 3 drinks per day for women and no more than 4 drinks per day per men. Personally, I think that's a lot. But if any one day a woman has 3 or a man has 4, we're going to consider that moderate. We're not likely to do damage any one day. But watch this. As a man, you can't do 4 drinks a day times 7 days. That equals 28 because we have weekly limits as well. So less than 7 drinks for women. I know it's not fair, but less than 14 drinks for men is our guideline around moderate consumption. So 14 drinks for men, that'd be 2 a day. Personally, my own opinion, I think you're doing nerve damage. I think you're doing body damage if you're having that much, but I didn't write the guidelines. This is what we find when we look at our guidelines. So following these recommendations is crucial to minimize the negative impacts of alcohol and reduce the risk of developing neuropathy. So there's a lot to be talked about on this screen, but how alcohol affects your nervous system. Number one, it is a depressant. It's going to lower things. Most people feel it as I feel a little calmer. It definitely impairs that central nervous system, brain and spinal cord, and the peripheral nervous system. It's going to affect that. Well, that's why most people will drink, because we want to have it affect that, right? It disrupts chemical signaling among nerves. Obviously, when you get to the point beyond tipsy, we're getting towards drunk, we're going to get slurred speech, we're going to have delayed reactions. That's why we don't want to operate heavy equipment, blurry vision, and many other things as well. Now, long-term alcohol abuse, this is where we start doing some sometimes permanent damage to our nerves. It can lead to memory loss, difficult walking, right? So long-term use can have that happen. Yes, it can lead to peripheral neuropathy. And this next one, alcoholic liver disease, bad thing to have. Road accidents, other accidents, domestic public violence, it can lead to crime. Cardiovascular disease, right? Things like high blood pressure. It even increases your risk of having heart attack and strokes. Many different cancers from the oral, the pharynx, the larynx, esophagus, liver, colorectum, breast, and more types of cancer. You're increasing your risk for that. And diabetes. among many others. How many? There's over 200 known causes of diseases or injury directly related to alcohol. That's just a few of them. So now what we want to talk about is the direct neurotoxicity of alcohol use. So chronic heavy drinking, so we go back to that guideline, more than what I just talked about, more than 14 drinks per week for men, more than 7 drinks per week for women. It can lead to the production of toxic metabolites that directly damage those nerves. Number 2, chronic heavy drinking leads to free radicals. These are bad things, little Pac-Man-like things that destroy cellular structure. So if we get our microscope out and look into the structure of the cell, it can destroy things like proteins and DNA. I underlined it, I bolded it, I put it in caps. The DNA, yeah, your genes, it can literally impact your genes and how you're expressing yourself. It can cause excessive glutamate release, further deteriorating nerve health. Now, glutamate is something that's important. It's crucial for life. We do need to have that. But just like so many other things, you can have too little glutamate, and that can be bad. And alcohol can cause too much or excessive glutamate release, and that can be bad as well. So we want to be in the right range there. And then the other thing is chronic heavy drinking can lead to suppression of the immune system. So you become weakened with your immune system, and that increases our vulnerability to infections that contribute to inflammation and nerve damage. Things like COVID, even the common cold, can be suppressed. Alcohol will suppress the immune system, leading us to other infections. Chronic, heavy, and I would probably say sometimes even moderate alcohol usage can lead to vitamin deficiencies. And we see a lot of these things online. It is definitely possible that B1 deficiency, B6, and B12, probably the most famous ones, those deficiencies can absolutely cause nerve damage. We call that peripheral neuropathy. So when you go online and you see a million different supplements, almost, I would probably say all of them is probably going to have B1, B6, B12. We'll see ALA. We'll see so many other things as well. But not that it's a bad thing to take those. Generally, we're safe to take B vitamins, but here's a little warning. B6 in particular. Again, you want to have the right amount. You can have too little B6 and cause neuropathy, but you can take too much and cause peripheral neuropathy. So we do need to be careful. We do need to be careful with just throwing B vitamins or other vitamins at it. But alcohol will lead to deficiencies in those. So these vitamins play crucial roles in supporting nerve health and helping those nerves to actually conduct the messages the way that they're designed to do. So insufficient supply of these vitamins can result in faulty neuron construction and function or operation. And like I said, these can cause neuropathy. So I'd say the best thing to do, rather than just start throwing the supplements at it, is you probably want to get tested for these deficiencies. It's pretty simple. You go to your doc and say, hey, can we run a test to see if I have any vitamin deficiencies? Not that complex. Symptoms of alcohol-related neuropathy, really symptoms of neuropathy. Burning, tingling, numbness, we see that almost all the time. For those of you who don't have neuropathy, maybe you're watching this for a family member or whatever, it's hard to imagine, like, how can I have burning and numbness at the same time? It seems like it's impossible. You can't be numb and have pain. Yes, you can. I did a video on this. It's called the video on frostbite or frost nip. I experienced it myself. I was actually doing tissue, cellular, and nerve damage when I went out and biked, and my feet were freezing, and I developed this thing called frost nip. That's the stage you get before frostbite. But wow, when I was on the bike, I was realizing I didn't dress properly. This is a dumb thing to do. I need to get back as soon as possible. My feet were numb and hurting as I was on the bike. I'm like, this is not good. I'm doing damage. As soon as I got back home, took the shoes off, took the socks off, tried to wrap them, tried to help them with the symptoms, and it was brutal. The pain that I was feeling from this frost nip was untreatable. I think I took a shot of whiskey. I was so desperate to give me any kind of relief. I think I went for a Motrin. I did everything I could. The reality was it just took time. And it took like 2 hours for these symptoms to go away. And for those of you who don't have neuropathy, I'm not suggesting go on a mountain bike and ride in the ice and the snow. That's a dumb thing to do. But I then got a concept of, wow, if this is what my patients are feeling, I also wouldn't be able to sleep. There's no way I'd be able to focus, let alone concentrate, let alone try and be a happy grandparent or whatever the scenario is. It is brutal when it gets to that stage. But you can also get prickly skin, muscle weakness, loss of coordination, cramping, paresthesias, balance problems for sure. The reality is if your nerves are dying off in your feet, how the heck is your brain supposed to know how to balance? And the truth is, it can't. It's getting garbled messages from the feet. You don't even know where your feet are. How are you supposed to balance? Well, I want to go back to paresthesias. What does that mean? I usually define that as weird symptoms. So just off the top of the head here, patients will say things like, it feels like there's cardboard underneath my feet, but I look down there, there's no cardboard. I had a nurse come in yesterday and she said, it feels like somebody's blown up a balloon and put it in my shoe, but of course there's no balloon in my shoe. My socks feel balled up. I get that one a lot. I get prickly sensations. It feels like there's ants crawling on my feet, up my legs. Like that'd be a terrible thing. Try and sleep with that. Lots of different weird sensations. One of the worst ones I had a patient tell me once, it feels like rats are chewing on my leg. Like, ow, that feels bad. It feels like my feet are in a campfire. So these are some of the things we would call paresthesias, like weird things, right? Like the nerves are so damaged, it's sending all this terrible information to the brain, and the brain's trying to make sense of it, like saying, what is that? Oh, I think a sock is balled up in your shoe, but when it's not, right? So paresthesias. So what are some factors influencing alcohol-related neuropathy? I would have to say the first one right off the bat is your genes, your gene expressions. So some people we know can tolerate alcohol real well, and others just can't. He's a light drinker. You can only have one drink and then you're drunk or whatever. So your genetic makeup coming from your family can absolutely make a difference. Age makes a difference. How old we are, the older we are, the slower we metabolize things. So that can make a difference. Whether we're exercising on a regular basis or not makes a difference. Let me just stop there. The research is out, it's pretty clear. Sometimes people think, oh, if I'm drinking an amount, I need to sober up, I need to dance a lot, I need to move a lot because I can sweat it out. Doesn't happen. It actually does not work. It can actually make you more dehydrated, which further adds to the problem. But what we're talking about is your exercise strategy. How often you exercise. Do you exercise? For those who don't exercise, you're going to be more likely to have alcohol-related neuropathy. Your nutritional status, whether you're eating really well or you're eating crappy, that makes a big difference as well, because we get our nutrients, we get our vitamins, we get our supplement, we get those things from things that we do on a regular basis, eating-wise. So what your nutritional status is like makes a big difference. Medication usages, we probably know this, but there's many medications that are influenced or affected by alcohol. So what medications you're on, how many you're on can make a big difference as to whether alcohol is going to affect your nerves or not. Liver is what processes the alcohol. If you have liver disease, liver dysfunction, things aren't working quite well there, then you're definitely not going to be able to process and get that toxin, which is called alcohol, get that toxin out of your body. So whether you have liver disease or liver malfunction will make a difference. And then this one I think is really important. How much alcohol are you having on a regular basis, and how long have you been doing that? A lot of us, back in college, everybody talks about college. We went a little crazy. We went on binges. We had a lot of fun. And for those of us who survived that and made it through, we think about some of the dumb things that we did, but we got through, we survived. Maybe there's 2, 3, 4, 6 years of binging, going crazy. But then we stopped and we brought it down to, say 2, 3 drinks a week or whatever. It can cause permanent damage. It can cause neuropathy. But how long you did it, if you're one of those people like a friend of mine that just binged and had a lot of fun in college and then just never stopped, that's going to be a factor. If you're like me, you had some fun, you're done with it, and now you've kind of dialed it back, it's less likely to cause permanent damage. Preventing alcohol-related neuropathy, the first thing that's most obvious, the way to prevent it is, don't start in the first place. But for sure, you want to stay within the moderate guidelines, if not less. Remember that there really is no safe amount of alcohol consumption. But if we're really working on prevention and I'm trying to work with guidelines, then we want to adhere to the low-risk drinking guidelines like we were talking about. I said that already. Regular exercise, we know that, right? What you eat, nutrition, and how you exercise affects everything, and that includes alcohol-induced neuropathy. To prevent it, we want to undergo periodic screenings. So these would be lab tests that you can do with your doctor. If you would work with someone like me, we do neuropathy testing to see if there's any damage. So that would be a way to prevent it. And if you are drinking more than moderately and you want to prevent it, then what do I say? You need to figure out how to stop, okay? That's the way to prevent it. But a lot of times we'll need professional help. There's some people in my family who just decided, I'm done. And they just, they're heavy drinkers one day, done the next day. For whatever reason, they decided this is not good for me. There's other members in my family that's gone through AA, that's gone, checked into clinics and then went out and then went back off the wagon and then got back on the clinic. So sometimes people need professional help. It is seriously addictive, and we have other underlying things that we really may need to dive into. Why are you drinking so much alcohol? Are you burying something? Are you numbing yourself? What is the underlying cause of all the alcohol? So that's where professional help comes in. Counselors, sometimes we need medications. I'm all for it. There are medications that are designed to help you get off the alcohol and kind of come down from that. You can look at those online, but really you want to see a professional on that. Now, if you're at the stage, or someone who you love or care about is at the stage of alcohol-related neuropathy, what do we need to do? So some of my youngest neuropathy patients come in with alcohol-induced neuropathy. Neuropathy is mostly a thing called a chronic condition, meaning the most common average age of my neuropathy patients would be around 70 to 80, around that age. If somebody comes in with neuropathy and neuropathy symptoms and they're 24, you probably have something like alcohol-related neuropathy. Maybe it's a drug-induced neuropathy. But the first thing, if I discover it's from alcohol, first thing, you need to stop. You need to stop. We have to stop the offending activity. Somebody once said, if you find yourself in a hole, like you've been digging yourself, how do you get out of it? Well, the first thing you have to do is stop digging, okay? So abstain from alcohol. Consider some pharmacological therapies. Those are drugs to help get off alcohol. I'm not a fan of drugs, but if we can take a drug to help you get off this one, and then we solve that problem, and then we get off the drug, then that makes a lot of sense to me. Physical therapy, exercise, same thing right there. That will definitely help to repair the nerves. There's nutrition again, so get some counseling. Basically, we need to eat really well. There's lots and lots of videos that I have on the YouTube channel that talk about my favorite diet, so we'll save that for another video. And then we can explore some complementary alternative medicines. So there's been a lot of talk about psilocybin. There's been some more research on that. Ecstasy, and believe it or not, some of these medications and some of these natural complementary alternative medicines can be helpful. So more research needs to be done on that, but there are ways to help you. So I really want to thank you for watching. That really should be everything you want to know. However, I don't know. Give me some feedback. I'd love to hear your comments down in the section. We do read those comments and we do reply. In fact, a lot of these videos come from your comments. Hey, will you talk about this? Or, hey, in that video about alcohol-induced neuropathy, you didn't cover X, Y, Z. Or I do want to know more about this, that, or the other. So I really want to hear your comments there. If you found this video to be helpful, do yourself a favor by clicking the subscribe button. When you click that button, what happens? First of all, it's free and we're not going to bother you, but every time I release or put out some more content or other videos, you'll get notified so that you can be up and current with what's going on. If you know someone with alcohol-induced neuropathy, obviously hit the share button and share with them this video. And maybe you know somebody who has neuropathy, or maybe you don't know, but they have burning, tingling, numbness, or other weird symptoms. Turn them on to this YouTube channel so that we can help people out. That's really what I'm here for. I want to help you out. Here's a little tidbit. I threw it in there. But little pop quiz, diabetes type 2 is the leading cause of peripheral neuropathy. And if you know someone who has diabetes type 2 or diabetic-induced neuropathy, refer them to this channel. I am so saddened that I was just off the phone with a very good friend of mine who I've known since the 5th grade, and his in-law, his father-in-law, is in hospice, and it's from diabetic-induced neuropathy that led to gangrene in his feet. Wasn't caught soon enough. He needed to have both of his entire legs amputated. They missed it. It's too late. This gangrene is affecting his whole body. So I say this to let you know that neuropathy is serious and diabetes is serious, and we do need to pay attention. So if you know anyone with neuropathy, with diabetes, diabetes-induced neuropathy, alcohol-induced neuropathy, then refer them to the channel. Share it with them. Together we can help more people find relief. If you are interested in working with me and my team, we are located here in Charlottesville, Virginia. We're 2 hours south of DC, but don't fret if you're from Austin, Texas, or you're from London, England, or you're from anywhere around the globe. Amazingly, we have technology. It's called Zoom. It's called telephones. It's called email. Most of our patients never even come into the clinic. Some do for the initial exam. All of the treatments is done by drop shipping equipment, etc. And we work with people remotely. So don't be afraid to reach out. You can put it in the comments section. Hey, I'm interested. For your HIPAA, for your privacy, I wouldn't share my email or anything like that.